Hi, my name is Danielle Dunn, and this is my medication administration video with Mrs. Jenkins. So I'm going to first start by coming to my patient's room, performing proper hand hygiene, and begin by introducing myself. Hi, my name is Danielle, and I'm going to be administering your warfarin today. I'm going to identify that it is Miss Jenkins by asking for her name and date of birth. And she told me. And then I'm going to start by raising her bed up to a comfortable position to prevent for any choking while she's taking her meds. I'm going to then ask her if she prefers to take them one at a time or together. And she said one at a time. And then next I'm going to tell her why we're taking it. Explain to her and her family what warfarin is, why we're taking it, and the potential side effects she could possibly see. I would ask her, I would assess her pain and ask her if she's had any previous side effects shown. She did say that she felt a little nauseous yesterday, but her pain on a scale of 1 to 10 would be about 3 or 4. And now I would explain to her and her family about what warfarin is and while she's taking it and the potential side effects. Miss Jenkins, come up here. I would explain to her that warfarin is an anticoagulant, so it helps prevent clots. And she's taking it because of your atrial fibrillation. And so this just going to help to make sure that she's not just throwing a clot, or help prevent it at least. And then side effects that you can look for is blood in your urine, so don't be alarmed, some tarry stools, maybe a little bit of blood in your vomit. You might see some discoloration on your skin, and that's just from a little blood being underneath there. And then lastly, petechiae, and that's just a rash. I would then begin telling her that some possible complications that could have come. I would advise you not to take it with aspirin, just because it will throw off the effects that warfarin is supposed to have. And then to avoid eating a lot of leafy greens, just because they're filled with vitamin K. And at that point, I would make sure that they have no more questions, and if they don't, I can begin the process of administering my meds. So first, I will remove the medications from the dispensary and look at my medication record and the label on here and make sure that it says 2.5 milligrams of warfarin, PO, 1800 each night. And they match, and so my first check is complete. My second check will be me getting the medication and putting it in a cup, leaving it in the wrapper, again, making sure that the labels match. And since they do both read 2.5 milligrams PO of warfarin by mouth daily, my second check's done. My third check, I can actually unwrap the medication, double checking it or triple checking this time, still making sure that the labels match and that it reads warfarin 2.5 milligrams by mouth daily, 1800. And so I've completed all 3 checks, and now I can give Mrs. Jenkins the medication. And I remember her saying that she would want it one at a time, just so it's easier to digest and everything. So I'm going to give her the medication. Let her finish it up. And then I also have some water to give her if necessary. Do you need some? Okay. And then I will then assist and make sure that she didn't have any difficulty swallowing, that all the medication is gone, that she's fully taken it. And after that, before I leave, I want to make sure that I put her in a comfortable position by lowering her bed to the lowest position that it can go, just to prevent any falls, make sure her guardrails are up, that she's yet comfortable, doesn't need anything else, and I'm going to make sure that I leave her call light in reach. And as I'm leaving, I then can take the medication and put the rest of it up. I will then go and document that I gave her warfarin at 1800 and it was 2.5 milligrams by mouth. And once I've done that, I can wait 30-ish minutes and then walk back in and assess Miss Jenkins' vital signs and then her PT and INR test, or like her lab results. Just monitor them and make sure that everything's good, see if she's experienced any side effects at that point. And then that's it. My name is Danielle Dunn, and that was my medication administration video with Mrs. Jenkins.